Hi, how you doing? My name is Andrea Santoro. I had a diagnosis of osteoarthritis back about a year and something ago. Can't really remember how long ago it was. The months are blending together. I had my right hip completely replaced in March of 2015, so it was about 6.5 months ago. I have about 4 or 5 videos on it, so I'm just going to make another one. I'm going to update you guys. Unfortunately, I have not been making videos because everything has been great. I've been on this path of, non-pain. Unfortunately, I've had quite a bit of pain still. I'm not out of pain yet. I have days that are better than others. I have no days with no pain. I had to stop taking the anti-inflammatories because they were killing my stomach. So every time I would go off of the anti-inflammatories, the pain would increase. The pain would never be gone completely, even with the anti-inflammatories. Pain medication only works to a degree. It does make the area feel better, but it also makes me hungry as a beast, and it makes me sluggish on the couch, like a slug, like a sloth. I can't do that. I have 2 kids. I have a full-time job, pretty much. I mean, I work from home, but so back to the orthopedist I went, and so he recommended more physical therapy. So I chose a different physical therapist. This one is a doctor of physical therapy. He's much more aggressive than the first person was. Now listen, the first physical therapist was treating me 2 weeks post-op, so she, of course, was going to be very conservative. This guy is not conservative. He tells me that I can do things that hurt. And the first physical therapist was just like, oh, that hurts, don't do it, So I have had 3 sessions with the new physical therapist, and my pain level is pretty high. It's pretty high. But I also increased my exercise a couple of months before I started with this physical therapist. So now in the past week, I've had to scale that back. So I have to find that balance all over again. So now this week, I'm not going to do any of my own exercise. I'm just going to do what the physical therapist has me do. And now I just came out of the orthopedist's office because he did an MRI of my low back, or he had me have an MRI of my low back, because he feels that even my initial pain before I had my surgery might have been due to something not necessarily coming from my hip, which is now new. It turns out that I have a bulging disc, very bulging disc, L4, L5, low back. Lower than my navel, but on the other side of my body. This is a very, very common area for disc bulging and degenerative disc disease, specifically for people who were overweight at any given time for any lengthy period of time. And I was, for a very long time. I was overweight. I never had a huge belly. I always pretty much had a decent waist, but doesn't matter. It also runs in the family. Low back pain is prevalent both sides of my family. So, and I also worked physically for a living. I was a massage therapist for 20 years. So it's understandable. The good thing about it is that he didn't find any kind of big cancerous tumor or any kind of a tear, nothing that needs to be repaired. You can't really repair the disc, you sort of have to just kind of teach the body how to deal with it. I'm not willing to go for cortisone injections yet. I'm not willing to take steroids because he also told me that that was an option. He told me that I could take non-steroidal anti-inflammatory drugs, which is basically Advil, Aleve, Tylenol, that kind of thing. In the past I've taken that and it doesn't really help so much. So I'm going to continue with the physical therapist. And unfortunately, the physical therapist, ever since I started, I've been in a lot more pain. So it looks like I'm going to have a little bit more pain for a little longer. And it might get a little bit worse before it gets better, which is amazing. It's amazing.
Give me fuel, give me fire, give me that which I desire. Ooh.
There's no other way for me to process this information except to process it with joy, because I'm not sick. I'm not technically broken. I just have challenges, and these challenges are new to me, even though I've been dealing with them for like in between 4 and 5 years, because I've kind of lost track of when this whole thing started. But it is what it is. I say that all the time. And I am just dealing with it. So right now, The physical therapist is working on strengthening my leg, the one that was operated on, from left to right and front to back, because the outside of my leg is very, very strong and the inside of my leg is very, very weak. It's not like one side is normal and the other side is lacking. It's very, very strong to very, very weak. The outside of my leg has been doing all the work for the past 6.5 months, probably even earlier than that, because I was compensating because I had a bad hip, I think. He's also been working on psoas, which is a very, very deep muscle. It's a hip flexor. Now that I'm going to bring him this new MRI report, I don't know if his treatment plan for me is going to change, but it might. I'm going to trust him because he's the physical therapist and I'm not. Technically, I have some knowledge when it comes to muscles and nerves and tendons and ligaments and all that kind of stuff, but I do not rehab people in this way. I'm going to do everything that he tells me to do. So, and I know that my diet is right. I know that, my movements are correct. I'm trying to do everything as ergonomically correct as possible. So, it is what it is. Okay. So if any of you have any questions about osteoarthritis in your hips, low back pain, discs, bulging, that kind of thing. If you are scheduled to have your surgery and you'd like to talk to somebody about it, if you've had your surgery and you had similar symptoms and you got through them in a specific way, or if you haven't gotten through them yet, you could talk to me. All of my information is in the description box of this video. I hope you all have a pain-free and fantastic and bilateral day. It's up to you guys later. Bye.